I'm Dr. Rachel Langley. I work here in Colorado Springs, Colorado at Homestead Direct Primary Care. I've done a video before on the typical things that I tell my pregnant or trying to get pregnant patients about things to watch for and behaviors to change while they're pregnant. I'll see if I can post it right there. But I recently read a book that changed how and what I talk about during that visit. It's basically just a big important thing to add in and doesn't change the rest of it. But the book is called Remedies for Sorrow. It's by Megan Nix. It's beautifully written, and it helped me think through a lot of my own challenges as a parent of many children that have some pretty specific medical needs. And so it was a great read. I highly recommend it. I was really worried that as a doctor I'd be offended by some of the stuff in there because some people write some pretty harmful, pretty hurtful stuff about doctors these days, but it was really fair and balanced, and I really appreciated that. So it's a book about her daughter and her experience with cytomegalovirus, also called CMV. And I'd actually heard of it before, unlike a lot of the healthcare providers that she experienced in her journey that had never heard of it. Remember learning about it in medical school. And then in residency, I was pregnant and I was exposed to an individual with CMV. So I went through some of the initial testing. I checked my blood, saw that I had never been exposed to CMV before, unlike the vast majority of our adult population in the United States. So that I was at risk for me getting CMV and my baby contracting it. It doesn't seem like that was the case in my situation, but it's something that was a little bit close to home. I remember going through that. And recently I gave blood, and again, they asked if I wanted to donate blood in a special way because my blood was CMV negative. I've never had it, never been exposed to it. So my blood is particularly good for giving to pregnant people or to newborns that need to not be exposed to CMV. So interesting things that it's plugged into my life. But what is CMV? It's a leading cause of stillbirth and some pretty significant developmental delays in little babies. And one of the problems about that is that it's contracted during pregnancy, mom passes it to baby, and 90% of women don't know that it exists. And that's a bummer. We know about all sorts of crazy things about cat litter and not eating sushi while you're pregnant, but not CMV, which is a really common virus, yet we don't talk about it. And yet there's some studies that show that if you know about it, you're 80% less likely to get it. So it seems that the knowledge is having an impact on moms and babies, but they just need to be educated on it. So what does it cause? It causes only in 10% of babies that are born having been exposed in utero while they're inside mom's belly to CMV, only 10% show any symptoms at birth. And those are symptoms that are really non-specific, not very helpful, like a rash, like having jaundice, that yellowish tint of the skin that most babies get at least a little bit of, having an enlarged liver and spleen, hepatosplenomegaly is what that's called, just being small for gestational age, just having a small head or microcephaly. But again, 90% of kiddos that are going to be impacted by CMV don't end up having any signs at all. But later, of those ones that didn't have any symptoms, there's still 25% of those that end up with hearing loss. And that's a big thing that I was taught in medical school, is that hearing loss is what I connect with CMV. 30 to 50% of those with symptoms at birth develop some sort of hearing loss. And hearing loss, I mean, the deaf community is a wonderful place to be. They've got their own culture, they've got language, they've got cool devices that help them to navigate the world. It's a cool place to be, but also if you could prevent your baby from being deaf in the first place, that might be pretty cool too. So that's why I've changed what I tell my moms, because it turns out that unlike a lot of viruses that cause cold-like things like rhinovirus, coronavirus, cytomegalovirus is not airborne. It causes a very flu-like illness. It's really also described as mono-like. I've never gotten it, but apparently there's a lot of sore throat, fatigue. There's also sometimes runny nose, achiness, headache, that kind of just cold kind of symptoms that you might brush off, but the fatigue does tend to last a long time, kind of like mono. So if you get that any other time of your childhood or your adulthood, no big deal. It's like a cold. You're going to fight it off get some good antibodies, cool. But if you happen to get it while you're pregnant, and sometimes it trickles down to baby, and that's when it caused difficulty. The moment baby's out for some reason, doesn't make a difference at all. It's just like a cold for baby. But whenever baby's in utero still, that's when the problems can develop. So what do you do to prevent this? Unlike many cold viruses, CMV is not airborne. It's not something that wearing a mask will help with. So mostly it's through bodily fluids, including urine, including breast milk. Those don't usually get tallied as dangerous ones, but actually CMV can travel in those. So being careful around people's bodily fluids when you're pregnant. So it's especially present in toddlers, in little kids. They tend to get CMV right and left, especially if they're in daycare. They just spread it like wildfire, and they don't necessarily have symptoms. They might not even act like they have a cold. So it's important, no matter how your kid is acting, that while you're pregnant, you not kiss them on the lips. Kiss them on the forehead, kiss them on the cheeks, kiss them on the top of their heads, but not on their lips. You don't share drinks with them. You don't finish their food. And you wash your hands, not just hand sanitizer. Hand sanitizer is not going to do it for CMV, unlike some other viruses. You really need to wash your hands for the full 30 seconds. 2 ABCs is what I tell my kids. And even after changing a wet diaper, I know sometimes I am only really diligent about washing my hands after a poopy diaper, and maybe I'll just use a little hand sanitizer when it's a wet diaper. But if you're pregnant, you should really be washing your hands for the full 30 seconds after wet diapers too, to avoid transmission of CMV. So that's what I really want to tell my pregnant patients, or my trying to get pregnant patients from now on. If you're worried that your baby might have been exposed to CMV, there are some signs on ultrasound that they might be able to see. They don't always show up, but calcifications, little white specks on their brain in certain places, particularly large ventricle, a part of their heart on ultrasound, or again, seeing that hepatosplenomegaly, enlarged liver and or spleen on ultrasound might lead you to want to be tested your blood for CMV or amniotic fluid for signs of CMV, to see if this is something you can be prepared for, just in case. Babies, again, they can contract it from the outside world after they're born. So the testing for CMV that they got while they were in utero is only really useful to do in the first 21 days of life. After that, you can't be sure if it was something that they contracted in utero or after they were born. And that test can be done by a saliva, a cheek swab, or a urine test to see if this is something that they should go on some antiviral medications for a while to see if we can prevent the CMV causing further damage as time goes on. So, interesting topic. Can definitely pull on the heartstrings, knowing all the impacts that this can have on families and kiddos. Hopefully this is helpful for you. Feel free to watch my other video that goes through everything else that you might hear on your initial visit after you find out that you're pregnant or you're trying to get pregnant. And feel free to please subscribe to me here so you can see when I post new videos. Thanks for watching.